speech and swallowing that's affected first, or arms and legs, sometimes breathing, and very occasionally cognitive problems. 60% of people with MND are male, so there's a slightly increased chance of developing MND if you're a man, but it's marginal really. Feeding tubes to people who have swallowing difficulties, again, it's an individual decision whether people want to have those treatments.
And what about the causes of MND? What do we know so far? Are there any risk factors that increase your likelihood of getting MND? Welcome to the Life and Loss podcast, where we seek to normalise conversations about illness and grief, helping individuals feel less isolated and alone. I'm Hannah, and today I'm joined by Annemieke, a Motor Neurone Disease coordinator. Annemieke listens to patients' needs and concerns, finds out what matters, and coordinates support in a timely manner, and therefore avoids crisis situations and unnecessary hospital admissions. Welcome, Annemieke.
Hi.
Thank you for joining me today. So for those that don't know anything about motor neurone disease or MND, can you tell me a little bit about what it is and what the symptoms are in the body?
Yeah, motor neurons are the nerves that send messages from the brain to the muscles to tell them to move. And in motor neurone disease, there's a premature aging of those cells, which means that over time, the hundreds of thousands of motor neurons die off and the muscles are left unable to move. So slowly causing a weakness to varying different parts of the body depending on which is affected first. So it can be speech and swallowing that's affected first, or arms and legs, sometimes breathing, and very occasionally cognitive problems can happen as a first sign of motor neurone disease. It's really an umbrella term for a group of conditions. Some progress more quickly than others, and some cause stiffness of muscles, and some cause a weakness and floppiness of the muscles.
And is there any, I know you've just said it's different in every person, but are there signs that people can look out for in themselves, or that healthcare providers can look out for in their patients?
I think that's really difficult because it's so different in different people, and the symptoms that people develop can easily be symptoms of a number of other conditions. So I don't think it's helpful for people to be worrying that different things they might have. I would just say, if you notice any changes, go and see your GP and talk to them about it.
What sorts of treatments are available at the moment for controlling symptoms and helping those that are living with this condition?
The only treatment that we offer people with motor neurone disease that helps to slow the progression of the disease is a drug called Riluzole. Riluzole was introduced about 10 to 15 years ago and originally was thought to prolong life by on average 3 months, which is not very much.
No.
And more recently, actually, the research is bringing that into question and wondering whether it's helpful at all. But we offer it to everybody, but when we have a discussion about the pros and cons, because it does have side effects as well, and we let each patient make a decision about whether they want to have that treatment. Other than that, it's really about managing symptoms. We offer non-invasive ventilation to people who've got breathing difficulties, feeding tubes to people who have swallowing difficulties. Again, it's an individual decision whether people want to have those treatments. And the other things we do is manage their other symptoms, so managing pain, constipation, spasticity, muscle cramps, all those kind of things, and providing equipment to help them to maintain their independence as much as possible. So hoists, stair lifts, all sorts of equipment for the home that can help make life easier for people.
And are there support systems available as well in the community for people living with MND?
There's lots of support available for people. In fact, sometimes there's so much people get a bit overwhelmed by it all. So there's lots of help from the Motor Neurone Disease Association. They offer local support groups, volunteer visitors, financial support, a whole range of things. And their website is really brilliant for providing information for people living with MND or carers of people with MND. And there's a huge number of healthcare professionals involved in supporting people depending on what their symptoms are. They might have a physiotherapist, an occupational therapist, a speech therapist, a social worker. Obviously, they've also got myself and the neurologist and the palliative care team as well. but there's lots of people available to help support people who are living with MND.
I hope that you are finding this episode useful. Perhaps you have a question you'd like to ask. You can do this by commenting below. Your input shapes the conversations we have and the topics that we explore. So don't hesitate to reach out and let us know what you'd like to hear more of. What misconceptions do you often encounter about motor neuron disease?
There's a lot of misconceptions out there. One being, I think historically, Stephen Hawking was the only famous person that we knew that had MND. And he had quite an unusual type of MND and lived for an unusually long time. Yeah. But that misconception has changed recently with Rob Burrow, who sadly died recently. And people now have a better understanding, I think, which is a mixed blessing, I think. It's sometimes helpful for people to know more about it when they're diagnosed, and sometimes very difficult for them to know what lies ahead of them. Yeah. The other misconceptions are around cognition. So historically, people have said things like people remain themselves and their cognitive function doesn't change, so their brain is still functioning in the same way as normal. But now we know that up to 50% of people with MND have some kind of cognitive or behavioural change. 10% of those people have severe cognitive changes. So that's really different from what we originally thought. And the other thing is that people often say people with MND don't experience pain, which is completely untrue. So they don't experience pain in the same way that people with maybe cancer experience pain, but they do experience sometimes severe muscle cramps and spasticity, which is really painful, and also just the discomfort of not being able to move or change their position at any time can be really painful for them.
Yeah, definitely. And what about the causes of MND? What do we know so far? Are there any risk factors that increase your likelihood of getting MND?
We still don't know the answers to those questions yet. We know 10% of people have an inherited form of motor neurone disease, where they inherit a gene which predisposes them to developing motor neurone disease, but doesn't necessarily mean they will get it. Okay. So they're more likely to get it than somebody without the gene, but they think it's dependent on a exposure to a number of other risk factors over their lifetime. And the same actually is true of people without the gene. They don't think there's any one cause. They think it's likely to be a number of things. The kind of things that they've been looking at, and the MND Association and My Name is Doddy Foundation have been funding research into this area. And they've been looking at mechanical and electrical trauma, people who've had military service, people who are very highly active, who exercise a lot or spend a lot of time outdoors, and exposure to some environmental pesticides and things like that. They've been looking at to see if those might be a risk factor for MND, but they haven't got any clear answers as yet.
Okay. And how about the likelihood if you're male or female? I know a lot of the famous people we see are male. Are you more likely to get it if you're a male compared to female? 60%
of people with MND are male, so there's a slightly increased chance of developing MND if you're a man, but it's marginal really.
And do you have any advice for those caring for a loved one with MND? What would you say to them?
I would say that the carers of people with MND are really important, and they often put themselves low down their priority list, and they say, this is all about the person living with MND and not about me, but actually they're really pivotal in helping that person with MND to have a good quality of life and be able to live at home. So I'm always encouraging people to get help, to have breaks from caring if they can, as early as possible in the disease progression, because it gets harder and harder as time goes by, and we need to protect them and prevent them getting too burnt out too early on. So just seek help, take what's being offered, and use the healthcare professionals around you as support to help you manage yourself in a way that means you can look after yourself and your partner or person living with MND.
Yeah. And anyone listening to our conversation today, listening to this podcast, maybe they've recently received a diagnosis of motor neurone disease, what would you say to them?
I would say reach out for help. As soon as you get that diagnosis, I would hope that somebody would be in touch with you, someone like myself, Certainly, I always try to contact people as soon after diagnosis as I can. If that doesn't happen, then reach out, find out who there is in your local area, contact the MND Association because they know all the local contacts in each area, so they can put you in contact with the right people to get you the help and support you need.
Thank you so much. And thank you for listening to the Life and Loss podcast. If you'd like more information on our work, you can visit our website, which is forestholmehospice.org.uk. Thank you. If you found this episode useful, click the subscribe button. Share this episode with a friend or loved one, and don't forget to give us a like and share your thoughts in the comments. Your support means so much.